Thank you for inviting me to talk today. So as mentioned, my name is Maria and I'm a clinical psychologist working at Maggie's in Manchester. So I'm here today to talk about managing anxiety. Oh, there we go. So the aims of the session today, I thought it might be helpful to just have a think about, so what is anxiety? And thinking about how that kind of maps into a cancer diagnosis. And then noticing kind of the struggle really. So like, what does anxiety look like for me? What am I going to notice? And then we're going to move into some tips for managing anxiety, and that's also going to include some guided practices. So hopefully that's helpful to get a taste really of some of the things that you could try in your own time. And then there's going to be an opportunity at the end for questions. So firstly, what is anxiety? So it is an emotional and physiological response to an actual threat or a perceived threat. And essentially what this is it's an inbuilt alarm system. So you might have heard of freeze, flight or flight as a response to a threat. So if you look to the image, I think that's quite a nice way of summing it up really. So as you can see, that person's being chased by a tiger or a lion, and their internal alarm system has kicked in and said, watch out, get away from this, keep yourself safe. And essentially that's what this is. So it can be triggered by an actual real threat, such as something like that. Obviously in our day-to-day now, we might not be seeing kind of tigers and lions knocking about, but there might be other things going on. And I think a cancer diagnosis is definitely one of them things, or a perceived threat. So what I mean by that is often it's usually a thought. So it's something that presents in our mind, but in the very, very same way, it turns on this internal alarm system and activates either freeze, fight or flight. And what it does, sorry, just to add, is it kind of it drives us to get away from, escape, avoid, or kind of take control of that situation. So that's quite key. And I guess now just thinking about, well, how does this map then for a cancer diagnosis? So I have put a picture of a roller coaster there because some people do describe the experience of diagnosis, treatment and post-treatment as basically being strapped into a roller coaster that you did not want to get on. It's absolutely terrifying. You are tossed and turned and you go through loop-de-loops and it's scary, but you kind of are in it and there's not much you can do about it other than just to ride. And then you kind of get off at the end and you look back at what you've been through, and often that is when you can have a significant emotional response as you start to process that experience. It's absolutely normal to experience anxiety. I know for many people they feel like that's not normal, they should be getting rid of this, I should be coping, but actually it's a completely normal human response to the threat of cancer. And there's so much kind of under that umbrella. So we know that a cancer diagnosis comes with a lot of uncertainty, and often you are having to live with uncertainty whilst you're waiting for results, investigations, consultations with the doctor. You're sitting with an awful lot of anxiety a lot of the time. And I think a huge one for people is fear of recurrence. So what we do know is that up to 90% of people who have had a cancer diagnosis worry about fear of recurrence. So it's huge. And also things like, kind of touched on it, but I don't know if you've heard the term scanxiety. We obviously have that term because of how common this is, and it just relates to that kind of period prior to a scan where you might start to notice that you can't concentrate, you're feeling changes in your body that feel uncomfortable, you feel anxious, but again, completely normal. And, you know, cancer brings a lot of change in many, many different ways. And I think a huge part of that is kind of a loss of role or feeling that you've lost your identity in some way. One example of that might be that you've been the person in your family that's been the one that people turn to, the rock, the support, and all of a sudden you're struggling and you're kind of falling into that dependent role, and that can be really challenging. We've also got to think about things like employment. There's potentially a loss of role there if you have to step back from your job. And then there's the impact of finances, You know, all of this stuff brings an awful lot of anxiety. And I don't know about people in the room, but I often hear at Maggie's around this sense of isolation. So feeling like nobody understands and can relate to what you're going through, and that can feel so isolating, and obviously comes with a huge level of anxiety. And then kind of thinking about partners and children, you know, your loved ones and the impact on them can add to anxiety. And absolutely huge, which we cannot eliminate from this conversation, is the impact of COVID-19. So if you were one of the people going through treatment during COVID, you will know that you were classed as extremely clinically vulnerable, and therefore you had to shield. And that had huge implications on treatment, going to hospital appointments alone, maybe receiving bad news alone, shielding in your own home, not seeing your friends. And actually now, you might be at a point where you're wanting to step back out, but that comes with a whole lot of anxiety. So we're going to have a think about that. But essentially, anxiety can be quite detrimental. It can affect your engagement in treatment if it's very severe, but also if we're thinking about quality of life, it can really have an impact. So let's have a think about what is this all about? What does it comprise of? What's going on? So at the top of this diagram, there would usually be an arrow pointing down that says trigger. So there's usually a trigger for what you're feeling. It might not be something that you're kind of overly familiar with or you've noticed, but there will be something that's fueling that anxiety cycle. So essentially it does become a little bit of a vicious cycle, and it comprises of a thought or a series of thoughts, a feeling, changes in your body physiologically that comes with that alarm system turning on, and then it can also change your response, so your behaviour. And what we know is that all these things are interlinked, as you can see from the arrows. So if we change something in one area, it's likely going to have a knock-on effect on the other three. So that's quite helpful for us in a way, because if we know that, it gives us a few angles in which we can kind of tap into this cycle and hopefully turn it more into a virtuous cycle. So that's what we're going to delve a little bit deeper in today. And we're going to we are going to focus on all those 4 areas and hopefully give you some tips and strategies for kind of breaking that cycle. So I just did want to kind of share a little bit of information about the physiological response when that alarm system is turned on. It's often one of the first things we notice when we feel anxious. So as you can see there, a whole lot of stuff happens in our body when fight or flight is activated. And the first thing that happens is adrenaline is produced. And what that does is it changes the way our heart beats faster, it pumps more blood around our body quicker. We might feel that we're having palpitations as a result of that. You might find that your muscles get quite tense because what your heart is doing is pumping blood and oxygen to the muscles that are needed for fight or flight, essentially. So your muscles, usually in your limbs, will get really tense and constricted, ready to kind of either run away from the threat or fight the threat. I won't go through all of them there, but these are some of the really, really common experiences and sensations that you can feel in your body. And often this can further compound worry, particularly if you've had a cancer diagnosis and you're thinking, oh gosh, what's this sensation? What's this new pain? But it's all very, very common and part of this fight or flight response. And then thinking about the role of thoughts. So I don't know if anyone's heard the term tricky brain. As human beings, we are all given this tricky brain when we are born. It's a very, very complicated thing that's very clever and has many competencies. And I guess back in the day, if we were thinking about caveman days and how that kind of supported us, it would be all about kind of basic motives. So, you know, love and connection and survival and getting food and taking that back to our families. But now it's kind of, as it's evolved over the years, it's very, very capable of ruminating, dwelling on things, being quite self-critical, anticipating future scenarios. So as you can see there, there's that kind of spectrum really, where present is in the middle, and then to one side, we've got kind of past focus. So you might find sometimes that your mind is very much kind of caught in the past and maybe ruminating on experiences and maybe beating yourself up for things that you feel you should or you must have done differently. And then future focused. So this is often, and I've circled this because this is usually where the worry comes in. So your mind will jump to the future. It'll be all about the what ifs, the worst case scenarios, and often anticipating probably not very nice scenarios, but it ends up feeling really real in the moment. So we're going to have a think about thoughts and maybe things we can do to try and bring our attention back to the present. So in terms of behaviour, our natural response if we feel threatened is to get rid of the threat. So it's all about survival. If we remove the threat, we feel safe again, we can calm, we can relax. And that's easy to do often if there's an actual threat in front of you that you can remove yourself from. But with those internal threats, that can be really difficult because our tricky brains present this stuff to us and we don't ask for it, but it comes, and that can be harder to get rid of. So for example, if I said to you, think of a pink elephant, and now remove that image from your mind, get rid of it. I'd be keen to hear at the end what people notice. But typically what happens is that the more you try and get rid of something internally, the more it sticks around. So actually our attempts to avoid and escape, so that might be distraction, masking how we're feeling, etc., doesn't always work too well. But it might also be avoidance of situations. So it might be not turning up to that appointment or avoiding social scenarios or actually withdrawing from people. And then another kind of element of this is like attempts to control. So what you might find is that if you feel anxious, we feel like we need to do something about it. So for example, if you notice that strange sensation in your body or that new pain, what you might do in order to kind of reassure yourself is to check. And sometimes you find that people are overly checking. But similarly to the thought, the more we notice a sensation, the more intense it can become, the more noticeable it is, and often it sticks around, and then we get more worried about that. So it's really, really complicated, and there is kind of short-term benefits to some of this stuff, like it can help us get through difficult situations, it can give us immediate reassurance when we need it. But if we're thinking about long-term, often what can happen is avoidance, particularly avoidance and escape. What happens is we don't find out whether our worst fear will come to light. We never get to test that out. So we avoid, and then the fear stays. So it kind of just fuels anxiety in the long run. So we're going to have a think about what's going to help. So hopefully some of the stuff today will be really helpful, but I think it's important to say that these strategies and things that we're going to be thinking about are not to eliminate anxiety. So that is impossible. Well, it's not impossible, but that's not our aim. So our aim is to almost think of like a radio playing music, and what we're going to do is just turn the volume down so that the impact is less intrusive. And as a result of that, and applying some of these things, you might find that your anxiety goes away, and that's brilliant, but that's not the primary aim. So it's to help you live well with anxiety that is naturally going to present as a result of a cancer diagnosis. So we're going to think about thoughts, we're going to think about where's your attention, and think about that present moment focus a little bit. We're going to have a think about goal setting, so particularly around how do I get going with something again that maybe I feel a bit anxious about. Kind of emphasising how important it is to talk to others, particularly when you're contending with some really uncomfortable feelings. And we're going to have a think about the role of relaxation in fight or flight. So just touching on thinking patterns to start with. So it can be really helpful because usually we're on autopilot a lot of the time. So thoughts present, we don't really notice them, we just treat them as fact and we buy into them, and our behaviour often changes as a result of what our mind presents. So the first thing I'd kind of encourage you to do is just start to notice what's going on in your mind. So what you might find is that's not easy to do initially, and it might be that once something's happened, you think back and go, what was I thinking about at that time? What was the potential trigger there? But it can be helpful to just notice which thoughts are guiding you in a positive direction and which ones seem to be more unhelpful. So maybe taking you away from the things that are really important to you, that you really care about. So just starting to notice and think to yourself, am I getting hooked by certain thoughts? So what I mean by that is, I don't know if people can see me here because I've just got my presentation up, but imagine your hands as thoughts. And essentially, when you feel quite overwhelmed by thoughts, your hands, if they were your thoughts, move straight up to your face. And I don't want to block so you can not hear me, but they become all consuming. So they get in the way and they hook us, they grab our attention. So thinking about maybe which of them thoughts are you getting hooked by more so. And what can be really helpful is if you just look to the other side of the screen there, there's a little kind of image. And if you look in the yellow bubble, the thought that this person's having is, it's my fault. And when we have thoughts like that, that feels very factual. We buy into that. I imagine we would feel quite sad and upset as a result of that thought. And that may then guide our behaviour in an unhelpful way. So what I'd encourage you to do is just pop a little phrase in front of these unhelpful thoughts that you start to notice, the ones that are changing your behaviour, the ones that are affecting how you feel, and just pop in front of it, I'm noticing, I'm having the thought that it's my fault. So what we're doing there essentially is, if your hands were kind of your thoughts and they were overwhelming, we're just popping them down here. So we're taking the power out of that thought. We're treating it for what it is, a thought, not a fact. And you're noticing what's going on internally. So if the thoughts are here and kind of away from your face, they're still there. We've not got rid of them, but we're just treating them differently. We're responding to them differently. So we can choose then how much attention we give to that. Equally, we can move forward with our day with that thought there. So I just encourage you to look out for them unhelpful thoughts and just take the power out of it, diffuse it a little bit, and just pop that phrase in front and just notice how, if anything, that changes the thought. Writing thoughts down can be really, really helpful, because what that does is it helps us to notice patterns or triggers for anxiety. And then once we know more about what the triggers are for us, we become more aware and we can maybe take a different response, or we can prepare for those difficulties when they arise. So I would encourage you, if that's kind of something you enjoy doing or you think would be helpful for you, jot them thoughts down. And then, you can have a think about challenging some of this thinking if it's appropriate. So, that thought there, for example, of this is my fault, you could go, okay, what is the objective evidence that this is my fault? So almost like you're popping that thought in a courtroom and you're doing for and against, what is the evidence? And hopefully what you should find is that there's more kind of, we're pushing the scales down. So actually you can kind of, again, take the power out of that thought a little bit. And one thing that I would recommend to everybody is this idea of perspective taking on some of these thoughts. So I would encourage you to see, or kind of think of a good friend and say, well, how would they respond to me if I was having this thought? What would they say? And turn some of that really helpful advice that we often give to other people inwards and do that self-compassion, that self-to-self relating. So that can just be really helpful, just to give us a bit of a helicopter view on the thought, on the situation, and help us to use the words that we'd use to a good friend, tone of voice, all of that stuff that comes with those really compassionate responses that we give to others, to ourselves. And now just thinking about present moment focus. So I don't know if anyone can relate to this image here, but it's the idea of kind of walking along and being with your own thoughts. And actually, is your mind quite full with lots of things, moving around and overwhelming? Or actually, are you being mindful, which is very much kind of taking in the environment, noticing, you know, all your senses, or actually you're feeling quite consumed by things. So it's that idea of not being present. So you're physically present, but internally you're somewhere else. So we just want to start thinking, where's your attention at these points? And mindfulness practice can be really helpful for when we feel overwhelmed by thoughts. So particularly like this first bubble here on this image. And there's lots of apps and things that you can use to support your practice. So essentially, mindfulness is not getting rid of that stuff, but it's noticing that it's happening, noticing what's showing up for you, and just gently and non-judgmentally moving your attention onto something else. So using your 5 senses can be really helpful for that. And I'm going to run through a little practice with you in a moment to kind of demonstrate how that can be used. But I would definitely recommend, if you're interested in practicing mindfulness, the Headspace app, and also Velindre Cancer Centre. I'm not sure if anyone's heard of that, but they have an app that you can download, which has got relaxation exercises on it and also mindfulness. And I recommend that to a lot of people, and it's really simple to use. So let's have a think. Have I moved back too far? There we go. So just want to do a bit of a guided practice with you now. So it shouldn't take any more than 5 minutes. But essentially what we're doing is we're dropping an anchor in that emotional storm. So when difficult thoughts, feelings, emotions are showing up for you, we want to ground you in that moment. Drop that anchor in the present, in the here and now. So if we think back to that kind of spectrum that I put on, with future focused on one end, past focused on the other, we're moving into the present, so into the here and now and your current reality. So I'm just going to run through a script with you. So what I want you to do is just find a comfortable position, just sitting where you are, and gently close your eyes just to minimize any external stimuli. And take a few moments just to notice what's showing up for you right now. So this might be thoughts, feelings, emotions, memories, sensations in your body, or maybe urges. And I just want you to notice them. I don't want you to change these in any way at all. Just notice with curiosity, like a scientist curiously observing your inner world. You aren't trying to turn away, avoid, or escape, or even distract from what's happening in your inner world. Rather, you're demonstrating a willingness to make space for whatever's showing up for you right now. Now I would like you to gently move your awareness to your breath. Just notice the sensation of breathing, the air moving in through your nose and gently exiting your body through your mouth. Just notice the sensation of breathing. And now I'd encourage you to just gently push your feet into the floor beneath you. And just notice what that feels like. Again, I don't want you to change it in any way, just notice that sensation. And what you might find as I'm talking and we're doing this exercise is that your mind is wandering, maybe to the past, thinking about the future. And I just want you to notice if that's happened. I don't want you to judge yourself for it, because we've got these tricky brains and that's what it does. I just want you to notice and gently bring your attention back to my voice. And you might have to do that quite a lot during this exercise, but each time you do, just notice and just gently and non-judgmentally bring it back to a focus point. So now I just want you to gently open your eyes and just notice what you can see in your immediate environment. So I'd encourage you to look for maybe 5 things that you can see. And now shift your attention to what you can hear. And look for 4 things that you can hear. It might be my voice, another voice, a sound in the home, or it might be something a bit further afield, but just notice. And now I want you to find 3 things that you can touch. So that might be the chair that you're sitting on, the floor beneath you, your clothing. 2 things you can smell. And 1 thing that you can taste. And now I just want you to bring your attention back to the room and the space that you're in and what you're doing in this moment. So that is a really simple way of just dropping anchor. So if you're in that emotional storm, if you're feeling overwhelmed, it can be a way of just using your 5 senses to just ground you back in the present moment. And what I'd encourage you to do is, it's really simple, because if you just remember your 5 senses, you can literally use it anywhere. So if your hands are in the washing up bowl, you can use your 5 senses. If you're brushing your teeth, you can use your 5 senses. And they're just really helpful ways of grounding, and nobody even needs to know that you're doing it. So what I'd say is practice this when you may be feeling good, get familiar with the process, and then it can be really helpful when you feel maybe overwhelmed. So I hope that's helpful. So just thinking about distraction and whether there's a place for this here when we're thinking about anxiety. So essentially what distraction does is it diverts attention away from the threat, whether that's an actual or perceived threat. And what I'd say is it's more of a short-term approach, and it's more appropriate for things like acute stress. So that might be if you're waiting in a waiting area for scan results, or you're dealing with some kind of acute side effects. It can be really helpful. And what I mean by distraction is anything that just diverts your attention and focuses it into something else. And things that can be really helpful are things like counting backwards from 1,000 in sevens. I mean, we all know how complicated that is. So it's going to take a lot of attention. So therefore, it's a really helpful distraction tool. Things like crosswords, word searches, Sudokus, playing a game on your phone, or even reading a book. All of these things are just quite helpful at kind of managing that immediate acute anxiety. So there's definitely a place for it. But what I'd say is use that as more of a short-term approach. And then if we're thinking about behaviour and coping responses, and particularly avoidance, I know I've kind of touched earlier on, like in the short term, the benefits of that is that we remove the threat. And that's really helpful for things that we can actually move away from physically. But again, we don't get to find out whether that worst fear that we had comes to light. So therefore, the cycle perpetuates. So it can be helpful to think about if you've got a goal that you want to reach now. So for example, if you're thinking, I really want to build my confidence again in meeting friends, what I would say is start really small and work up to that overarching goal. So break that down as small as you need to. So there's a bit of an acronym there called SMART goals. I don't know if anyone's heard of that, but it stands for the goal being a specific goal, so we know exactly what we're working towards. It's measurable, so we're going to know when we've achieved it. And it's also small enough and realistic that we can achieve it. So we're not setting ourselves up to fail. And it's timely. So we might say to ourselves, right, on such a day, this is my goal, and I'll know that I've achieved it because, you know, I've done it for 10 minutes, for example. So start really, really small, really lower that bar. Watch out for shoulds and musts. So those thoughts that say, I should have done this, I should be better, I must do this today. Because essentially what that does is it sets the bar really, really high. And if you're contending with anxiety, or you're contending with side effects of treatment, you're not going to be feeling 100%, and therefore you're very unlikely to hit that really high expectation that you've set for yourself. And shoulds and musts really fuel that. So what I would suggest is turn a should into a could, and turn a must into a maybe. And what that does is it just really brings the bar down so that you can set yourself a realistic expectation. And hopefully once you've hit that, because it's nice and achievable, you're going to feel fantastic. You're going to feel like you've achieved something, and you're going to feel like you're moving towards them goals. So hopefully that's helpful in terms of thinking about any goals that you've got. You can literally apply this to anything, whether that's exercise, changing your diet, meeting friends, getting to treatment, whatever that is. That can be a really helpful way of breaking it down. And just communicate to people. If you're working on a specific goal, let people know what your limits are at this time. So therefore, there's no expectation other than what you've communicated, and they can meet you where you're at. And that can be really helpful in terms of eliminating any external pressure and making sure that you continue to go at your own pace. And then when we're thinking about uncertainty, so there's an awful lot of stuff that feels really uncertain when it comes to cancer. So what I would encourage you to do is find things that you can control. So particularly things that align with your values and your interests. So putting activity in your weekly diary, putting things in to look forward to, even blocking out time to do things like reading or anything that you find helpful. It can be helpful to put that down on paper. So if we're feeling overwhelmed and we've got a lot of stuff going on internally, we're less likely to go and meet that friend or sit and have that self-care time, because it'll just get eaten up by everything. But if you pop it down and you plan ahead, you'll know what's coming, and that'll be something that you feel that you are in control of. So yeah, kind of finding things that you can take back control of in that kind of uncertainty umbrella can be really, really helpful. And then thinking about applying the other things we've maybe had to think about, particularly around those perceived threats, thinking whether, is this something I can actually action and work on and therefore eliminate that worry, or is this something that maybe I need to apply a bit of mindfulness to or do some of them thought strategies with, because actually it's a perceived threat. And then never underestimate talking about how you feel. So we have 2 ears for a reason and 1 mouth. Sometimes all you need is just a good listening to, and feeling heard and validated, and having your experiences normalized. And it's really easy to feel isolated when you feel anxious or low or whatever that might be. So it can be so helpful just to kind of share that with somebody else. And you can also kind of check out any fears or assumptions that you've got. So particularly thinking about what we do at Maggie's, often people will come in with lots of worries around treatment and what's to come, and their mind has told them that it's going to look a certain way. But if you check that out maybe with a professional, so it might be your CNS, your GP, a peer, you can kind of get the evidence that you need to hopefully reduce that worry. And I know in COVID times, if we're thinking about seeing friends and family, WhatsApp, FaceTime, Zoom has just come into its own, and it's allowed us to maintain them connections with people when maybe we're not feeling confident enough yet to physically get back out there. So use the resources that are available to you, and find your team. So what I mean by that is that you'll have friends and family, and they've all got different qualities, and pick out those qualities in people that you know are going to help you when you're feeling not at your best, and draw on them people when you need them. So hopefully you can have a think now about who might be in your team and who's going to help you through those more difficult times. But again, use your CNS resources, use your GP, and obviously there's ourselves, Maggie's, but I know there's other cancer charities out there as well. For us, we are an open door policy. You just walk in, you do not need an appointment. Come in, have a chat to us if you feel that you need that. And then just thinking about sleep. So anxiety can really have a detrimental impact on sleep. So what I've done is just pop some sleep hygiene tips on there. So essentially, we're just thinking about what's going to optimize sleep. So thinking about your screen time at night and turning that blue light off on your phones and your tablets and your computers. Maybe kind of doing some relaxation before bed, jotting down any worry thoughts. So keeping a little notepad next to your bed, pop them out of your mind and onto a pad. that can be quite helpful just for calming the body and mind. And having kind of a regular routine can be really helpful. But I'll leave you to kind of have a look at those, and hopefully you can get a copy of these slides if needed, and just have a think about what your current sleep routine looks like and whether you feel that you want to make any tweaks to that. And then finally, relaxation. So essentially, if we engage in a form of relaxation, it is the antidote to fight, flight, and freeze. So it results in a rest and digest response, which is calming the body, calming the mind, making sure everything's working as it should do. And there's different forms of relaxation, but essentially my key takeaway is make sure you make time to relax. So there's lots of kind of suggestions on there if you're unsure of what that might look like. And these can be solitary things that you do, or they might be social. And you can also use your breath. So some really simple kind of relaxation practices, really, where you just slow down your breath and you kind of elongate the out breath. But we're going to have a little practice now. So I was going to do initially a relaxed breathing practice, but I'm going to do a progressive muscle relaxation, which hopefully delves a little bit deeper and you leave today feeling nice and relaxed. So what I'm going to do is I'm going to run you through a script. It should take about 5 minutes. So I'm just going to check the time. Yeah, we're all right for time. So again, I'm just going to encourage you to either sit back, lie down in a comfortable position, and shut your eyes if you're comfortable doing so. And just begin by taking a deep breath, noticing the feeling of air filling your lungs. Hold your breath just for a few seconds and then release. Breathe slowly and let the tension leave your body. Take in another deep breath and hold it. Again, slowly release the air. Even slower now, take another breath. Fill your lungs and hold the air. Slowly release the breath and just imagine the feeling of tension leaving your body. And now we're going to move into focusing on some different muscle groups in your body. So I want you to look after yourself. I don't want you to strain yourself in any way. So you're going to be aware of any kind of injuries or problems that you've got. So any muscle group I mention that you know you've got an issue with, please skip over that and just focus on your breathing. So initially, I just want you to move your attention to your feet. Begin to tense your feet by curling your toes and the arch of your foot. Hold on to the tension and just notice what it feels like. And now release the tension in your foot. Notice the new feeling of relaxation. Next, begin to focus on your lower legs. Tense the muscles in your calves, hold them tightly, and just pay attention to the feeling of tension. Release the tension from your lower legs, and again, notice the new feeling of relaxation. Remember, throughout this exercise, continue to take deep breaths. Next, tense the muscles of your upper leg and pelvis. You can do this by tightly squeezing your thighs together, and make sure you feel a tenseness without going to the point of strain. And release. Feel the tension leave your body. Begin to tense your stomach and chest. You can do this by sucking your stomach in. Squeeze a little harder and hold the tension. Just a little bit longer. And release. Allow your body to go limp. And just let yourself notice the feeling of relaxation. Continue taking deep breaths. Breathe in slowly, noticing the air, fill your lungs and hold it. And release the air slowly. Feel the sensation of air leaving your lungs. Next, tense the muscles in your back by bringing your shoulders together behind you. Hold them tightly. Tense them as hard as you can, but without straining, and keep holding. Release the tension from your back. Feel the tension slowly leaving your body and the new feeling of relaxation. Notice how different your body feels when you allow it to relax. Now tense your arms all the way from your hands to your shoulders. So make a fist and squeeze all the way up your arm and hold it. Release the tension from your arms and shoulders and notice the feeling of relaxation in your fingers, hands, arms and shoulders. Just notice how your arms feel limp and at ease. Move up to your neck and your head. Tense your face and your neck by distorting the muscles around your eyes and mouth. Hold for a moment and then release the tension. Again, just noticing this new feeling of relaxation. Finally, tense your entire body. Tense your feet, legs, stomach, chest, arms, head and neck. Tense harder without straining, but just hold that tension for a moment. And now release. Allow your whole body to go limp. And pay attention to the feeling of relaxation and how different it is from the feeling of tension. And just begin now slowly to wake your body up, gently moving your muscles. Just adjust your arms and your legs, give them a shake if you need to. Stretch your muscles and open your eyes when you're ready to do so. So that is a progressive muscle relaxation, and I hope people found that helpful and you're feeling nice and calm. So we're now going to have a think about questions. So thank you everybody, thank you for listening, and I'll hand back over.
Great, thanks ever so much, Maria.
No problem.
Really, really helpful. So if you have any questions for Maria, do drop them in the chat and then I'll read them out for her. And just while we're waiting for those questions to come in, just to say to everybody, you know, as Maria was saying, it's really important to reach out and talk to people. So just a reminder that our support line is available Monday to Friday, 10 AM to 5 PM. You can give us a call, we can set up a Zoom, text message. I'm trying to remember all the different channels that we've got, instant chat to our website. So please do get in touch with us, and any way that you prefer to communicate, we can accommodate that. That's not a problem at all. And also we have our online forum if you want to chat online to other people who are diagnosed or affected by ovarian cancer, and our various support groups that we run that are all on our website, as well as our Friday Q&A chat. So do come along to those, and hopefully that can help alleviate the anxiety and you know, reduce the isolation from talking to other people in a similar situation. So let me have a look. So Molly's put in our support numbers. Thank you ever so much, Molly. And she's put in our forum links and and our events pages for the different support groups. So thank you ever so much. So someone's asked, Maria, there isn't a Maggie centre near me. Do you offer anything remotely?
So at the moment, we've got some things that are virtual and some things are back in the centre. And I know different centres are maybe doing more virtual at the moment. So it might be just worth having a think about where you do live. And I know it might be a distance, but which is the closest one to you. If you go onto the Maggie's website, you will probably find the centre there that's closest. And they should post their timetable on there. So you can have a look at anything that you might be interested in and then just give them a call. So different centres work in different ways in terms of how they get you signed up to these things. But I would really encourage you to reach out because a lot of them are still offering remote working at the moment.
Great. Thank you, Maria. Anything else that anyone wanted to ask? Something that occurred to me, Maria, I was wondering, I mean, all the tips that you mentioned that would help with anxiety will probably feed into this as well. But when you're talking about reading a book and things, do you have any tips about improving concentration? Because sometimes people say to us, oh, you know, I used to love reading, or I used to love watching Netflix series, but I just can't concentrate long enough.
Yeah, so I think I probably kind of skipped over this, but concentration is really affected when fight or flight is active. And the reason for that is because when maybe you've kind of been in a prolonged kind of stress state, what happens is the adrenaline increases cortisol production in the brain, and that affects your hippocampus, which is responsible for things like concentration, memory, decision making, because essentially what you do is you reach back into that internal filing cabinet when you're wanting to make a decision, for example, and you pull on similar experiences to help you do that, but that's not as accessible when the cortisol is stimulated. So some people go, gosh, I'm losing my memory, but actually it can all be related to the fight or flight. So what I'd say is, particularly for things like concentration, mindfulness can be a really helpful skill to practice. So essentially what that is it's just learning to redirect very gently and non-judgmentally your attention back to what you're doing. So I'd say if concentration is something that you're struggling with, maybe start bringing mindfulness into your day-to-day routine. And again, it can be really informal. So like I said, it might be that you're just you're doing a washing up, drawing on your five senses. What do I feel? What do I, smell, hear, etc. And each time your mind wanders, just go, thank you, mind. You've gone again. I've noticed it's gone. I'm just going to gently pull back to what I can feel on my hands or what I can hear. And each time that happens, it's that practice of just bringing it back. So I think for concentration, mindfulness can be really helpful. But again, things like, because it affects your memory as well, doesn't it, when you can't concentrate? So I'd encourage you to do a bit of scaffolding type stuff. So what we mean by that is just writing stuff down, having a diary. You're not going to forget it then, hopefully. If it's on paper, you can refer back to it. So just using some scaffolding really just to support you through those periods where you might be finding it harder to concentrate or harder to kind of remember stuff.
Thanks, Maria. And someone's asked a question about help with lack of feelings, feeling a numbness with life. Okay.
So that's another really common experience that I think maybe isn't spoken about enough. So essentially, when you go through that adjustment process, when you're given a diagnosis, a big part of that is that sense of numbness, disbelief, shock. And I think typically people think, well, I should be feeling something, but actually it's really normal not to feel something as well. And hopefully that is just a phase that you're working through as you're kind of adjusting to life with a diagnosis. But what I would say to you is, if that starts to get in the way of your day-to-day life and your quality of life, I would suggest reaching out and maybe having a chat with someone. So whether that's your GP or one of the local charities or even your local NHS service, it might just be helpful to maybe get a bit of extra support around that. But it is completely normal.
Thank you, Maria. Okay, so someone said years of numbness, so that would be a time when you...
Yeah, so I'd maybe think about having a chat with your GP and seeing if they might be able to kind of get you some additional support.
Thank you, Maria. Any other questions for Maria? Maria, I think one of the things that comes up sometimes is when people are doing the mindfulness and relaxation, that they can put a lot of pressure on themselves. They feel that they're not doing it properly.
Yeah.
So how would you suggest sort of doing it routinely, or just seeing what how would you suggest people practice in a way, just sort of broadly?
Yeah, so what I'd say is there's not really a wrong way to do this stuff. So particularly with relaxation, if it's having a calming effect in any way on you, then that's helpful. So keep doing what's working. I think it's when it comes to the mindfulness, people think this isn't working. And I think maybe it's to do with their expectations of what that is. So I think mindfulness can sometimes be confused with relaxation, but actually we're not, the primary aim of that is not to relax you. So it's to make you actually quite alert and to notice what's happening. And the whole idea of mindfulness is that idea that my mind will definitely wander, whether it's past or future, and just noticing that's happening, and the practice is just gently bringing it back. So don't get me wrong, once you bring it back, it will go again. So some people might be like, I'm not doing this right, but that is it. So you're dealing with your tricky brain, it constantly wanders somewhere, and you'll have to just keep practicing bringing that back as many times as you need to. And honestly, sometimes it might be 20, 30 times in a practice. But yeah, you know, sometimes mindfulness has a secondary benefit of relaxation, and that's wonderful, but it's not its kind of primary aim. So as long as you're noticing and you're gently bringing your attention back, non-judgmentally, because we're all dealing with these tricky brains. There's no point in beating ourselves up for it when our mind goes, because it's very automatic. Then you're doing it well. But what I would say is daily practice is definitely recommended, because we're asking your mind to do something very different than what it's used to. It's a new skill, really. So it's a bit like when you train a muscle group at the gym, you've got to practice and you've got to build up your attention muscle, essentially. So what I'd say is practice that when you're maybe feeling good, and get familiar with the strategies and the experience of it. And then hopefully when you're in maybe that emotional storm, it feels more accessible, and you're confident in knowing what you're doing and what the aim of that is.
Great, thanks, Maria. Someone's asked, is it healthy to have ongoing numbness of feelings and just getting on with day-to-day life after a diagnosis?
I think what's really tricky is that there's no time frame on this. And I think that's what's hard, because people want to know, right, when will I stop feeling this and when will I maybe feel this? But it's essentially the same as a bereavement. So it follows a grief curve or a change curve, and there is no time frame on that. Obviously, if you felt that numbness, and again, it's all about the impact on your day-to-day life. So that's going to look different for different people. Some people might feel that it doesn't stop them from doing anything that's important to them, that they're interested in, whereas for other people that numbness might ground you to a halt. It might result in you withdrawing. So I'd encourage you to think, for you, what does that look like? How is this affecting my life, and is this workable? And if it's not, then that's when I would maybe think about reaching out and getting a little bit of support. But again, I guess just coming back to the Maggie Centre, we are literally open for you just to walk in and you can have a chat with somebody. No appointment is needed. They can help you to unpick this a little bit and think about whether that's something that they can support you within the drop-in space, whether any elements of our programme might be helpful for you, or whether it's a referral to psychology, and all that can kind of be talked through with you. So I guess, yeah, thinking about impact, and I'd encourage you, if you think, right, this is having an impact, to kind of step forward and reach out for a little bit of support.
Thank you. And someone's commented, dealing with family who perceive you've changed. That might be because you've started concentrating more on yourself.
Yeah, again, this is something that crops up an awful lot. So I think particularly post-treatment, people kind of have an expectation that maybe because you're looking physically well again, your hair's grown back, you look well in yourself, your complexion, you're doing a bit more, that you're feeling okay and you're back to normal, whatever that looks like. But we know that that's definitely a new normal. And as a result of what you've been through, so that idea of getting off that roller coaster, looking back and actually doing the processing through this, your values might change. What you see as important in life now might look completely different to what it looked like before. And that's absolutely normal. And you hear people say, my career is no longer important to me. It's actually about spending time at home. So they resign from their job. Or actually this relationship really isn't working for me now. And, you know, it looks different for different people. If you were the person that was always cleaning the house and now you're like, this isn't what I want to be doing with my time anymore, that can upset other people because they're used to what you did do. But it's really complicated. And I think my advice would be around kind of communicating to people where you're at now and explaining that things do look different and that what is important to you now is maybe changed.
Yeah. Great. Thank you ever so much, Maria. We really appreciate your time. We've come to the end of the session, but we've had lots of comments about how helpful it is. So thank you ever so much for speaking to a really important topic.